Here is a detailed guide on sodium nitroprusside, covering each aspect comprehensively. 1. Basic drug information. Generic name, sodium nitroprusside. Drug class, vasodilator. Antihypertensive agent, nitrate derivative. Drug forms, intravenous solution, powder for reconstitution. Brand names, NITROPRUSSIDE, nipride. Definition. Sodium nitroprusside is a potent, fast-acting intravenous vasodilator used primarily in hypertensive crises and acute heart failure. It acts directly on both arterioles and venules, leading to rapid and balanced vasodilation, decreasing systemic vascular resistance and preload-afterload, thus reducing blood pressure and myocardial oxygen demand. MASHARTA 3. Mechanism of action. Sodium nitroprusside releases nitric oxide, NO, when it enters the bloodstream. NO activates guanylate cyclase in vascular smooth muscle cells. This increases levels of cyclic guanosine monophosphate, cGMP. cGMP inhibits calcium entry into cells, causing relaxation of vascular smooth muscle. Results in arterial and venous vasodilation, leading to preload, afterload, blood pressure, myocardial oxygen consumption. Indications. Sodium nitroprusside is used for hypertensive emergency, rapid BP control, acute decompensated heart failure, especially with pulmonary congestion, controlled hypotension during surgical procedures, aortic dissection with beta blocker to control reflex tachycardia, short-term treatment of severe congestive heart failure. 5. Contraindications. Avoid use in patients with hypersensitivity to the drug or its components, compensatory hypertension, e.g. AV shunt, coarctation of the aorta, Leber's hereditary optic atrophy, severe renal failure, thiocyanate toxicity risk, severe hepatic failure, detoxification of cyanide, vitamin B12 deficiency, elevated intracranial pressure, untreated hypothyroidism, risk of precipitating myxedema coma. NITROPRUSSIDE 6 precaution before taking this medicine. Ensure continuous BP monitoring is available. Correct volume depletion before initiating therapy. Use with caution in elderly patients and those with hepatic renal impairment. Watch for signs of cyanide or thiocyanate toxicity. Avoid prolonged use, 72 hours. Protect solution and infusion line from light exposure. Avoid in patients with recent MI unless necessary. Caution with increased intracranial pressure. How to use. Administer IV infusion only, never by IV push or bolus. Use an infusion pump for accuracy. Must be diluted in 5% dextrose solution, D5W, before administration. Typical dilution, 50 milligrams in 250 milliliter D5W equals 200 milligrams per milliliter concentration. Protect from light using opaque tubing or aluminum foil. Infusion should be titrated to effect while monitoring BP continuously. HAD 8. Dosing information. Initial dose, star 0.3 milligram kilin IV infusion, titration, increased by 0.5 milligram kilogram mn every few minutes. Usual therapeutic range, 0.5 to 8 milligrams per kilogram mn. Maximum dose, 10 milligram kilogram mn, not to be used 10 minutes at this dose. Duration, short-term use only, discontinue as soon as BP is controlled or patient is stabilized. 9. Missed dose, overdose. Missed dose, not applicable in continuous infusion settings. Overdose signs, severe hypotension, metabolic acidosis, cyanide toxicity, confusion, seizures, cardiac arrest, thiocyanate toxicity, tinnitus, psychosis, muscle tremors. Management, stop infusion immediately. Administer hydroxycobalamin or sodium thiosulfate as antidote. Supportive care, airway, fluids, vasopressors if needed. SARC 10, stop or avoid taking. Stop or avoid the drug if the patient develops hypotension unresponsive to dose reduction. Neurological symptoms, confusion, disorientation. Signs of toxicity, visual disturbances, tinnitus, metabolic acidosis, elevated lactate or cyanide, thiocyanate levels, tachyphylaxis or loss of BP control. Side effects, in detail. Common, nausea, headache, dizziness, restlessness, sweating, palpitations. Serious, hypotension, cyanide poisoning, confusion, metabolic acidosis, seizures, cardiac arrest, thiocyanate toxicity, especially in renal failure, blurred vision, tinnitus, delirium, coma, methemoglobinemia, cyanosis, dyspnea, fatigue, reflex tachycardia, chest pain, arrhythmias. 12. Vital information. continuous BP monitoring, preferably intra-arterial. Monitor cyanide thiocyanate levels if infusion 72 hours or at high doses. Avoid rapid infusion or bolus. Can lead to irreversible hypotension. Use only in ICU OR settings under close supervision. Light sensitive, degradation can release toxic byproducts. Do not mix with saline or other incompatible fluids. Knot 13, drug interactions. Drugs that may interact or affect sodium nitroprusside. Drug class interaction. Other antihypertensives. Additive hypotensive effects. Nitrates, e.g. nitroglycerin, enhanced vasodilation, risk of hypotension. Phosphodiesterase inhibitors, severe hypotension. Anesthetics, propofol, enhanced BP lowering effect. ACE inhibitors, ARBs, risk of excessive BP drop. Diuretics may worsen hypotension. Neuroleptics, antipsychotics, additive vasodilator. Thank you. Have a nice day.